now. So we will start off with any bill introductions. Representative Turner.
Thank you, Mr. Chair. On a normal day, Vice Chair, but thank you, Mr. Chair. I'd like to introduce RS 0850 on behalf of the Kansas Hospital Association, and it's a bill that deals with Kansas Nursing Initiative Grant Program.
Sorry. Yes, Representative Ellis. Nope. Okay. Any other bill introductions? Representative Howell.
Thank you, Chair. I have two. The first one is RS 0841 on behalf of Kansans for Life. And it has to do with transferring the power to authorize and oversee certain activities regarding prenatal and postnatal diagnosed conditions, awareness programs from the Department of Health and Environment to Kansas Council on Developmental Disabilities. And the second is RS 0620 on behalf of Kansas Family Voice. And it's Every Mom Matters Act, and it's about having eligible organizations to provide information and support services to pregnant women.
Thank you. Any other bills to be introduced? Yes.
Thank you, Mr. Chair. I've got two. RS 0748, prohibiting certain terms in a contract between health insurer and dentist. And then RS 0749.
Just 1 second.
Oh, Kansas Dental Association.
Continue.
And then this is also Kansas Dental Association. RS 0749, providing that the selection of alternative payment methods by a dental provider will remain in force for the duration of a contract with a dental benefit plan.
Thank you. Any other bill introductions? Yes, Representative Ellis.
Thank you, Mr. Chairman. This is on the benefit of the Attorney General. It's RS 0851 to report identifying information to all people who win at the casinos, to report their winnings not only to the Internal Revenue Service, to the KDHE.
Thank you. Any other bill introductions? Yes.
Thank you, Mr. Chairman, members of the committee. My name is Heather Sprague, and I'm here on behalf of the Kansas Association of Chain Drugstores. I would like to request RS number 0899, which would allow pharmacists the independent prescriptive authority to administer certain vaccine to children and adults.
Thank you.
Thank you.
Any other bill introductions? Without objection, we will accept the bill introductions. Next on the agenda will be a presentation by the Kansas Academy of Family Physicians. Dr. Jennifer, is it McKinney? McKinney. Thank you.
Oh, thank you. Sorry, I'm too short.
Welcome to committee.
Thank you so much. I think we're pulling up slides, but
okay.
In the meantime, I'll introduce myself. So thank you so much to everybody for letting us be here today. My name is Dr. Jennifer McKinney, and I'm a family physician. I'm speaking on behalf of the Kansas Academy of Family Physicians. And if we want to go to the next slide, I just want to tell you a little bit about myself first, and then we're going to talk family medicine and all kinds of really great things about what we do. So I was actually born and raised in Fredonia, right? I got a Southeast Kansas person here. I think another one. right? Okay, Southeast Kansas representing. All right. So I was born and raised in Fredonia, in the hospital where I work these days. I went to KU for undergrad, and then I went to KU Med in Kansas City for my first and second year. I went to KU Med in Wichita for my third and fourth years of clinical rotations, and then I went to Via Christi for my residency in family medicine. And then I returned to Fredonia for a little thing I like to call the circle of life. If that looks familiar for the Lion King, okay, great, great. I give this talk to students sometimes, and they're like, what's the Lion King? That's how I know I'm getting old. So you might ask, how does someone become a family physician? Well, what we have to do is after we graduate from high school, we do 4 years of undergraduate studies. We major in mostly scientific things, scientific degrees. We go to 4 years of medical school, and then we do a bare minimum of 3 years of training, which leads to over 16,000 hours of clinical training. So I bet you went to more training, yeah, I think? Okay. But it really is a lot of training and a lot more than you'll see in other healthcare professions out there. But what does a family physician do? We do a lot of things. So this is actually my dad and I. One of the best things that I get to do these days is work with my dad, who's been a physician in Fredonia for 46 years. He's a general surgeon. So he's the one with the mustache, just in case you weren't sure. And this is us again. This is us more recently. He's still the one with the mustache, but as I get older, it's hard to be the one without the mustache. So, but that's us. We're super adorable. Look at us go. But then we've actually also recruited other physicians to our small town who are what I like to call big city folks. So that's very exciting. And a nurse practitioner as well. One day we were actually on the Today Show, which was kind of cool because they were talking about how not many physicians go into private practice anymore, but we're doing it and we're thriving and we're taking care of our community. So we were really proud to be able to be part of that programming. So anyone else know Days of Our Lives? By chance, it kind of raised me. Stefano, Marlena, they're still alive. It's fine. But Days of Our Lives, this is what we do every single day. So a family physician, especially in a rural area, does it all, right? Because we're kind of the only gig in town. So if you need help, that's what we do, is we just help you. So we take care of patients in the hospital, in inpatient care. We do procedures like colonoscopies, endoscopy, lesion removals, stress tests. We do surgeries. I assist my dad with surgeries like gallbladders and appendix. We, of course, see patients in the clinic. We're also the emergency room doctors as well. So, and then we run all the committees and the medical staff. So just everything that makes the hospital run, that's what we have to do because that's what we're trained to do, and that's what we get to do to care for our patients. So I mentioned that we do procedures like colonoscopies. That was something that I got really good training in at Via Christi, and something that I think is a good service to our community. Because imagine if you didn't have your colonoscopy done in Fredonia, you would have to drive to Wichita or Kansas City. And you know what you have to do before you have the colonoscopy? You have to drink this stuff. And so on Highway 400, you do not want to be drinking bowel prep. So we do that for our community so that they can do these things right at home, and it's nice and clean, no messes. Okay, sorry, we might go back one. But this day was a special day because when I started practice with my dad, my mom said, hey, do you need more practice on colonoscopies? And I said, this is a weird question. Can you pass the salt? This was at dinner and, normal things. And so she said, well, I need a colonoscopy. So what I did was I actually fulfilled every little girl's dream of performing a colonoscopy on her mom alongside her dad. So this is as much an informational session as it is a motivational session. You can do whatever you dream to do, people. But this was Family Colonoscopy Day. And as I said, we're also the emergency room physician. So anything that walks in the door. I was on call Monday. We do 24-hour shifts and 72-hour shifts where anyone that comes in, that's our responsibility. So Monday morning, I got to see a toothache at 4 in the morning. But sometimes we have a 10-car pileup on the highway. This day, Fredonia is surrounded by lakes, Fall River Lake, Toronto Lake, that kind of thing. I was sitting in the ER, and a dad walked in with his son, and he said, hey, I think my son got bit by a copperhead. We were out at the lake. And I said, well, how do you know? And he slowly lifts up this bag, and this bag is angry. It's just wiggling like this. And I say, what is that? And he says, it's the copperhead. And I'm like, why did you bring a live copperhead into the ER? And he said, so you would believe me. And I was like, they look the same dead. I would believe you either way. So that's the actual copperhead that we put in a sharps container. And I said, take it away, do what you want, send it over the Rainbow Bridge, whatever. I don't want to know. But this is what we do, and this is what we have to train to do as family physicians, because you just never know what's going to happen. All right, next up, just a little bit more about what we do. Those are kind of some of our fun stories, but we really do a little bit of everything. We try to keep people healthy, preventive care. We're the women's health physicians as well, so people don't have to run off to an OBGYN every time they have to have women's health done. We take care of that too. We do pediatrics. We take care of the nursing home patients. I'm the hospice director for the community, and so we take care of hospice patients. We do all the mental health. It's so hard. You guys know this, right? Like, it's so hard to find a mental health professional because we're in such a shortage for that. So we're doing the things where we treat anxiety, depression, schizophrenia, anything that people need. That's what we do. And we're the emergency room doctors, like I mentioned. We treat high blood pressure. We treat side effects of chemotherapy when people are diagnosed with cancer, and we diagnose people with cancer. Basically, really, if you think about, do our patients want to run to Wichita or Kansas City or even Pittsburgh or Joplin or wherever else if they just need to adjust their blood pressure medicines? Probably not, right? For us, that's an hour-and-a-half minimum drive for everybody. So we have to be the doctors that can take care of everything for our patients. All right, next slide. So this is my dad and I again. We're just adorable. Look how cute we are. I mentioned that he does surgeries and I assist him in surgeries, and I think that's a huge thing for our small hospitals to do, because we talk about small rural hospitals closing all the time, but what the people that you see in these rural hospitals are us family physicians and cool general surgeons like my dad. But we help support the hospitals, which also support the communities. So the communities thrive because the hospitals thrive. One of our surgeries, one of my favorite stories of surgeries is when my dad was seeing a patient for abdominal pain, and he had been seeing her a while. And so finally he did a CAT scan, a CT scan of her belly, and then he left town. He's like, bye, I'm leaving. And so the radiologist called me and said, hey, your dad ordered a CAT scan on this patient, and we think there's something in there. Great, that sounds ominous. So we took her to surgery the next Monday, and we opened her up, and my dad, my dad and I ran the bowel, right? So we had to feel along the colon and small intestine to see what was going on. And then in what's called the transverse colon, the middle of the colon, not the end of the colon, not the beginning of the colon, but the middle, we felt something. We opened it up, and then right inside was a full-size toothbrush. Not lying. Because I bet every single one of you right now are thinking, well, did it go up or did it go down, right? That's like everybody's reaction. And so we were like, okay, this is crazy. So we closed her up, and we were waiting for her to wake up. We're just sitting there watching her, like, wake up, we want to know. And then when she woke up, she told us that she did swallow a toothbrush once upon a time, but she didn't really think it was a big deal. But she did have a minty fresh colon. Thank you very much. But just kidding, that part, it's still a colon. But it was really, like, these are the amazing things that we get to do in rural America, because we don't have trauma surgeons or GI surgeons or anything else. But we do have our great general surgeons and family doctors. So, all right, next slide, please. So why does a family physician do what we do? The only answer I have for that is on my next slide here. It's for the people. So sorry, they're supposed to kind of slide in there, but on this slide, I actually have people that I've taken care of for years and people who were taking care of me when I was a kid, and that's a really, really cool thing. The little picture on the side with the little girl, I have a patient that dresses up like me every time she comes in for her well visit. It's adorable still, until she becomes a teenager. It's going to get weird, but then otherwise until then it's cool. And then of course, my friend that's in the lower right-hand corner, we used to ride the school bus together, and so this is why I do what I do, because these are the people that we surround ourselves with, and they need to be healthy and they deserve to be healthy. And that's why I have my kids front and center, because I strongly believe that no matter where you live in Kansas or anywhere in the United States, you deserve to be as healthy and have the same high quality care anywhere, no matter where you live, and that should never be compromised. So I need my kids to have the best quality care that they can have in Southeast Kansas or anywhere else. So that's exactly why we train really, really, really hard, and we do what we do, because nothing less than the highest quality care is good enough for my kids. Next slide, please. So what do we do outside of the hospital and exam rooms? We actually do a lot, right? Especially in small towns. We kind of are seen as people who might be okay at doing things. So next slide, please. So one of my roles is as the county health officer, and no one knew what that was before the pandemic. And actually, I didn't know what it was. I kind of agreed to it because the one before me passed away, and I said, well, what do they do? And my health department administrator said, well, they sign things. You know, it's really easy. And I said, okay, that sounds super simple, until the pandemic happened. But you know, the other things that we do, we help make sure that people are educated on vaccines. We help people with smoking cessation. We write grants to bring in money to our communities to help with things like, you know, like hunger and homelessness and things like that. One time, I even inspected a lagoon because the lagoon inspector was out. So I had to read up on it. I watched a YouTube video. I brought my clipboard, and then I made it look like I was like doing really important things. I knew what I was supposed to be doing, but I didn't, kind of. And then I was like, this lagoon is clean. So now it works. It's great. But you know, there's a lot of things that we do, and if we don't know how to do it, we learn. We learn on the fly. So next slide, please. I know that throughout the pandemic there was, there were some hard times with public health and things like that, and I worry that after that people kind of think that we're saying like, oh, we want people to stay home or wear masks. In reality, we're doing exactly what we do, and most of our local health officers are family physicians across the state who are doing these kind of things on the side because it's the right thing to do and because no one else will do it. So, and most people are doing it as a volunteer job or for just very minimal, minimal pay. But we do it because of the same things that I said on the other slide. My kids, my neighbors, my former school bus friend, you know. So next slide, please. What we really look like is this. This is on my birthday every year. I ask my employees if they want to wear pajamas to work, and we take care of patients in our pajamas. And that's my flying squirrel onesie. Okay, so much information. All right, next slide. But that's who we are. We're family doctors across the state doing public health to try to just keep everybody safe as possible. But also outside of the exam room, you know, you go to the one grocery store and we take care of people when you're in the produce aisle and they say, can you take a look at this rash? And they're scratching and they're grabbing the tomatoes and they're scratching and I'm putting back my tomatoes, but we do it again because what are we going to say? Sorry, I can't help you. No, happy to help. And then let's follow up tomorrow in the office. So we just do kind of the right thing when it's necessary. Next slide. We're the local team doctor. I like to say we provide a lot of support for the teams. But you know, if anybody gets hurt, even if you're not officially there in that capacity, you run onto the field or run onto the court because kids, you know, they get hurt. They need help. So next slide. And as I mentioned, I'm also the local home health and hospice director, and that actually spans throughout the whole region for our reach for home health and hospice. And it's just another part of care that we were trained for and we're able to do. And we don't have geriatricians, we don't have specialized hospice doctors, so we step in and we try to do that for our patients. Next slide. So what do we do beyond healthcare also? Again, lots of hats for family physicians and throughout, you know, all of the community. Next slide, please. A few things that I did is I started the Community Foundation to keep money in our community so that we can continue to grow because we all know small towns are at risk for not growing. And then I was also on the school board for 9 years, the president for 2 years, and you know that's another important role that we play, and I think it's important for everybody to do their part for the community. I created Cultivate Fredonia, next slide, which is a community growth initiative. I won't give you all the details, but I also started a festival there called Sausage Fest. We can talk about that in another session. But that was our T-shirts after the pandemic that said, bigger and more satisfying than ever. But we have wiener dog races, hot dog eating contests, things like that. we raise money for the entire community, and because of that, every second grader in Fredonia gets a bike every year, whether they need one or not. We have walking trails. We have beautification projects. We fix the downtown. Anything we can do that's again the right thing for the community, but with a fun way to get there. Next slide. We have the Fredonia Medical Academy to encourage students from Fredonia to come back or get educated, come back and become our lab techs or our nurses or our physical therapists. So that was something else I started as a family doc in my community. Next slide. And then how can we get more family physicians into Kansas communities, especially in rural areas, right? Because if every community in Kansas is healthy, then the whole state is healthier. And what we find in these rural communities are family physicians from one end of the state to the next. Next slide, please. I just, have a few ideas there of, making sure that we're valuing the expertise and the training that we go through to do the work that we do and to hold the many roles that we hold as family physicians. We want to support family physicians in their multiple roles, and that might include being a hospice director, being a local public health officer, any of those roles that we hold, because from time to time we hear there are bills and there are things that kind of don't support what family physicians might do or physicians in general might do in these different roles. But they're very, very important roles that we play to keep the communities thriving. Supporting and expanding incentives. Oh, sorry, thank you. And that might be things like the Kansas Medical Student Loan Program, for example. I think that's in the budget. I'm not sure exactly where we are with that, but there's when we graduate from medical school these days, it's at least $200,000 of debt. But when a student takes out a loan from the Kansas Medical Student Loan Program, a physician does, then if they practice in a rural community for the amount of years that they took out the loan, then that loan is forgiven. And what better incentive to get people into rural areas than to say you are debt-free and all you had to do was serve people in a rural community. So those are the kinds of things that we really can see will incentivize people to go into rural areas. Just valuing primary care and the work that we do, maybe new residency programs, who knows? We don't have enough residency spots to create all the family physicians that we would like throughout Kansas. So we export our really great educated medical students out to other states. And so that's unfortunate because they may not come back. And then tax credits, that's another thing that we believe in with the Kansas Academy of Family Physicians, because rural preceptors are ones that help educate our students. And if they don't get that experience in rural communities or in urban communities, our students won't experience what we want them to throughout Kansas, to see how great of healthcare we provide, and then they may not go into primary care or may not get the education to become those high quality doctors. So we have to value our preceptors, and that's one way that we can do it, not necessarily paying them, but saying, hey, we value what you do, and here's how we want to show appreciation for that. But there's all kinds of things we can do, because we do believe that family physicians are a really foundational piece of every healthcare community and every community in Kansas. Okay, I think that's it. I know you guys are in a hurry, so do you have any questions for me?
Thank you. This is a very, very good presentation. Yes, Representative Berquist.
Yeah, thank you. Oh, I'm sorry. Thank you, ma'am, for being here. And where can we get your book?
By
And
the
if you
end
don't
of the
have it,
session.
why?
No, it is fun because I think people don't always realize what we kind of do day to day, and I love to share it because it's just fun and it's exciting and keeps it very enjoyable.
Thank you.
Representative Weichel.
Thank you, Mr. Chairman, and thank you for being here today. You're clearly a very important asset to your community. I was wondering if you could speak a little bit to what healthcare is available for the people in your community who are uninsured.
Absolutely. So really, in Fredonia itself, it's us again. So we offer payment plans for anybody without insurance. We believe in just taking care of people, and we figure out the rest later. It's just kind of what we do because it's the right thing to do. if, we all know we have to keep the doors open still, but our hospital does the same thing. They offer a lot of charity care, but all of the clinics there do. We don't have any safety net clinics in our community, but we do have some in surrounding areas in Southeast Kansas as well. But I do think we're seeing a growing number of people without insurance, and especially we see that in Southeast Kansas. So we just try to do our part, but there's definitely a need for bigger solutions.
Representative Oropeza, did you? Okay. Representative Droege?
Thank you, Vice Chair. Thank you for that presentation. I just want to say it's an honor to be the representative representing Fredonia.
Thank you very much. We are honored to have you. Come visit anytime.
Yes, now I just want to say there's a warm spot in my heart for family physicians, and I appreciate what you do with the emergency room, the clinic, the hospital, the hospice, the nursing homes, procedures, health department. Makes me wonder what you do in your spare time.
I hang out here in Topeka, I guess.
Okay, and also I lost my toothbrush. I was just...
Wait, I think I found it.
Okay, thank you very much. That's a very good presentation. We appreciate it. Thank you. Oh, is there one more question?
Oh, I think.
Oh, I'm sorry. Susan, Representative Ruiz.
Thank you, Mr. Vice Chair. Thank you so much for your presentation, your enthusiasm. Special place in my heart for family physicians in rural areas of Kansas. My wife was born and raised in Wakini.
Yeah.
We got married and she had to move to Johnson County. And she got all her health care in Hayes.
Wow, yeah.
We are now going back to Hayes because she could not find a physician that she could get in to see. She's got a lot of health issues and couldn't get in to see. And so she called her physician in Hayes and said, well, come on back. And so we make the trip to go to Hayes. And I've gone into those appointments with her. And there is a difference between a family physician in a rural area and a family physician in an urban area. We don't have the time for me to even explain the differences that I see, but thank you so much for your work. Thank you for sticking around and promoting what you do. We do need more physicians, and this is why I fight very hard to make sure that physicians, their scope of practice is not infringed upon.
Thank you so much. We appreciate it.
Thank you, Dr. McKinney.
Thank you all. Thank you for having me.
I know we're short on time. I think we have two more presenters. If we could hold it to maximum 15 minutes each, 10, 15 minutes if possible. We have a presentation on oral health in Kansas by, is it Dr. Brunner?
No, I get mail like that, but no, no.
Tanya, okay.
Thank you. No, my name's Tanya Dorf-Bruner, and I am not a dental professional. Hang on. Holly's on the other side. Sorry. Trying to make this as difficult as possible. Sorry. And I got to say, this is a really hard act to follow. Heavenly days. Especially when I'm fumbling with the dang computer.
That's why I didn't do a presentation.
You were right, Kevin. There we go. Okay. We should be able to make this work now. Okay. Hopefully this will work.
Being all the way.
Oh, sorry. I know, I just used up most of my time doing that. So thank you, everybody, for the chance to be with you this afternoon. I will make this fast. If you've heard me testify before, you know, unfortunately, I can talk pretty fast. You know. So I'm grateful to be with you. Again, my name is Tanya Dorf-Bruner. I am not a dentist, but I am at the Executive Director of Oral Health Kansas, and I've been there for a number of years. I've been there long enough that now I do get mail addressed to Dr. Bruner, and I just think, well, that's the easiest way to go to dental school possible. You just get a job, and they just send you mail. We'll get there. Oh, shoot. Do you want me to just use your slide?
Yeah, I'll bring up your slides.
Okay. I'll just kind of start talking while we do that. So I'm going to go over a handful of things. I just want to talk briefly about us as an organization, talk a little bit about some Medicaid dental resources that we have and just what's covered in the state, talk about some Medicaid dental advocacy if you all, and many of you are on the Social Services Budget Committee, so you could probably do that part of the presentation for me. Talk about a tool we have called My Dental Care Passport, some educational programs we have, and then some advisory groups. So that's kind of a roadmap of what you'll hear. Here we go, perfect. So if you could go to the next one, and then probably keep going. That's just the roadmap, and then you can go one more. So yeah, thank you. This is just a overview of what our mission at Oral Health Kansas is. So we are, as I said, the state's consumer oral health advocacy organization. We focus on a number of ways of trying to improve oral health in our state. We focus on policy change, public awareness, education, and stakeholder engagement. And you can see at the center of all the work we do is the consumer voice. We'll kind of talk more about that here in a few minutes. If you go to the next slide, this is something we created shortly after I started this job about a little over 15 years ago. I came here, and everybody kept saying, oh my gosh, we need to work on access to care. We need to work on access to care. And I kept saying, that's great. I agree. What does that mean? And the more we got into it, if everybody in the room walked around and said, what do you think access to care means? Each of us has a different answer because there's lots and lots of different things that make that up. So we decided let's kind of think about it as a three-legged stool, that if you have access to a way to get a dental provider, if you have access to a way to get pay for dental care, and if you have access to the public health things that keep you healthy, like community water fluoridation, healthy foods and drinks, then you're going to have pretty good oral health. So that's how we think about access to care, and that's really how we organize our work, and especially our advocacy work. You can go to the next slide, and I think then I'm going to talk about some Medicaid dental resources. I'll try to make it brief here. So this is just a quick slide to just show you some of the improvements in the Medicaid dental program over the last 3 years. And this committee and really everybody in the legislature is responsible for this. You all have done a lot of work over the last 3 years to invest in the Medicaid dental program. And at this point, all adults and all kids have always had dental coverage, but now all adults also have dental coverage. They have fillings, crowns, periodontal care, which is gum disease care. They have denture coverage, and then they, of course, have basic exams and x-rays and cleanings covered. So because of your investment, all those services are now covered. And actually there's, I know you have access to these slides. There's a lot of links. Feel free to grab any of these links if you want to put them in a constituent newsletter. There's a lot of stuff that might be useful for some of your constituents. But if you go to the next slide, just talks about a web page we have that does have some of those resources available. The next one then shows specifically what we have. Oh, I'm sorry. The next one, we've got this fun little video we created. It's about a 60-second video. It's on our website. It's also on YouTube that just says, here's what's covered for adults in Kansas, and here's how you can access that. It's just kind of a fun little animated video if anybody wants to use that. The next slide then is just a quick recitation of what's on our dental website, our Medicaid dental website. There's a frequently asked questions document for consumers that says, hey, what's covered? How does that work? How do I find a provider? There's a little flyer in both English and Spanish. Similarly, there's a frequently asked questions document for providers. That's significantly longer because there's a lot more details providers need to know. There's some links to becoming a Medicaid provider, and there's a great interview with a dentist in Kansas City named Dr. Aaron Booman. I think I'm the chair of his fan club. He's just a very enthusiastic Medicaid dental provider and loves to teach people about why it's such a great thing to be a Medicaid provider. So there's a little video interview with him, just dispelling some myths and helping people understand why it's a great decision to be a provider. I think that might be it. So now we'll move into Medicaid dental advocacy for this year. And again, if you're on Social Services Budget Committee, you do know this already. I want to start with the fact that this is what the Medicaid dental provider network in Kansas looks like. There's 41 counties that don't have a Medicaid dental provider at all. They're all in rural communities. I thought the previous presenter was just a really powerful presentation about the value of having physicians in communities. We need dentists in communities too. We've got 41 counties where we don't have any Medicaid providers. So, and only about 30% of Kansas dentists are even Medicaid providers at all. So we've got a lot of work to do. The next slide. This just gets at the barriers. There's a number of barriers to dentists becoming Medicaid providers, and if you know, some dentists, many dentists do take private health insurance. Some dentists don't even take private health insurance. So if you're thinking about trying to build your small business in your small community, it needs to be worthwhile in order for you to keep your doors open and keep serving people. So you've got to be able to have rates that make sense. So 4 out of 5 dentists say that the rates are the biggest barrier to them becoming Medicaid providers. I didn't put it on here, but administrative barriers are another issue that dentists have. Just how do I become a provider? That sounds hard. How do I learn how to bill? How do I learn how to prepare for audits? How do I learn how to just do all the pieces of that? That's another really significant barrier. It's worth noting in the Missouri and Colorado, their rates are about twice of what our Medicaid rates are. And Kansas rates, as I've talked about other insurances, Kansas rates are about 60% of what a private dental insurance rate are. in Kansas, rates are about 37% of what dentists can just charge fee for service. So you can see they're just not keeping pace at all with what it takes to run that business and be a dentist in a small community or a large community. Yeah, so this is the next thing I'm really excited about. I mentioned administrative barriers. So there's that's a big issue. And when busy professionals are busy, they don't have time to stop and learn how to be a Medicaid provider. There's a lot of details about that. So there is a program now in the state of Missouri where they have something called a dental Medicaid facilitator program, and it's both outreach and then it's a technical assistance program to teach dentists how to become Medicaid providers, help them with all the logistics of that process. Our counterpart in Missouri implemented that program. At the same time, the Missouri Legislature implemented a really nice rate increase 3 years ago. And after they did both of those things, implemented a rate increase and implemented that facilitator program to help with the administrative barriers, 3 things happened within 2 years. The number of dental providers increased by 450 new dental providers in Missouri in the Medicaid program. 80,000 more people received care, and the number of rural counties without a Medicaid provider went from 36 to 17. So just a dramatic change when you pair the technical assistance and help with a rate increase, which I think takes to the next slide, which says where we are in Kansas. So we're getting started. We actually have a grant at Oral Health Kansas. We're starting to start the process of creating our own dental Medicaid facilitator program. We've hired somebody to do that role, and we're going to be doing a lot of outreach in those 41 counties that don't have any dental provider at all of the other counties as well, but we'll focus on those. And then the last slide in this section, I think, just gets at what that rate increase request is. So we and our partners, we've got over 36 organizations have signed on to some advocacy to try to get a rate increase implemented this year. This was actually a recommendation of the interim sedation special committee on sedation dentistry, was a recommendation to do an overall rate increase. And we're just excited because I feel like it's easy to say we need a rate increase, we need to increase the provider network, but it's easy to say that, but when we say we know the winning formula, we know how to make that successful because we have the resources to do it with this facilitator program. It's a winning formula, and we're really excited about the prospects here. So I'll try to be brief and go to a couple of other subjects. My dental care passport, oh my gosh, this is the coolest thing ever. So if you go to the next slide, this is a communications tool we created with many of our partners over the last 3 or 4 years. It's a way to help people with disabilities talk to their dental offices about their specific needs. So it helps people talk about any physical needs they may have if they're in the dental office, any sensory needs, if there's sights or sounds or smells that are going to be a trigger for them. It's also things like if, for example, I'm nonverbal, I might say when I'm in the dental chair, I need you to talk to me, not to my caregiver. Just respect me as the person that you're working with. Just things like that. We've got lots of stories already about how dental offices and individuals are becoming much more successful because they're able to use this communications tool. I would encourage you, if you'd like to, use this and share this with your constituents. I'll show you some resources in a second. And it is endorsed by all the MCOs and by KDHE, I'm happy to say. So I think there's a couple more slides with some resources. This is just some excerpts from what it looks like. It's an online fillable form. People can use it however they need to just on our website. Next slide is, another little animated video. This is another little short video just describing how the passport works and how to use that. It's on YouTube or our website. And I think the last one is these neat help sheets. So it's a great idea, again, to have this tool. That's nice, but we put together these help sheets to actually help providers and consumers understand how to use it and make it work in their lives. I think we'll go to education programs, and I'm going to be really fast, I promise. We've got a few education programs I just want you to be aware of. So we do a lot of consumer education. This is just 4 quick examples. We have a program called Feeling Good About Your Smile. That's a program that is a hands-on demonstration project for people with individuals with IDD to learn about oral health and learn about taking care of themselves. We have something called Brush Book Bed that helps families of young children like 0 to 3, learn how to make a routine every night at the same time you brush your teeth, you get in bed and read a book, and then you go to sleep. So you've got a routine going, and we've got a program around that. Something we've got called Begin with a Grin, which helps medical providers actually learn how to incorporate dental pieces into their own work, how to incorporate fluoride varnish, how to incorporate some coaching and some referrals and asking good questions in those medical visits. And the last one, I'm so excited about this. We're just getting started with it, but we've just started this program called Success Begins with a Smile. Everything's a cute name. And this is working with youth and juvenile detention centers, helping them learn about oral health, learn why that's important, learn how to take care of themselves, because they will be getting back into the community, and we want them to be successful and put their best foot forward. So excited about that. We've implemented in Wyandotte County, done it 2 or 3 times there, and looking at some of the other juvenile detention centers now. I think we've just got one, oh, no, I'm sorry. Ooh, this is exciting too. I get excited about all this stuff. We also have an educational program for providers it's a Project Echo series through the University of Kansas. This is actually from 2023. We're getting ready to implement it again here this fall. It's a way to teach dental offices how to be comfortable serving people with disabilities, and there's a whole lot of modules around that. It's a really neat program. I can go into detail if you're interested in learning more about that. And I think the last section then is advisory groups. Again, just to let you know kind of who's advising us, who's at our table. So over the last 2 or 3 years, we created a lived experience advisory group. This is a picture of several of the members when they presented at a dental conference last summer. This is a group of individuals with disabilities and their family members and caregivers. They are at our table helping us make sure all of our materials and resources do make sense for consumers. Sometimes some of the words we use maybe don't make the right sense for consumers, and so we fix that. They're doing a lot of educational programming. They've done presentations for the UMKC dental students. They're working on lots of things like that. So they're really important core advisors for us now, and they're also really showing a lot of mutual support. This was so successful. In the next slide, we actually have just created a new advisory group called the Provider Experience Advisory Group, and this is a group of dentists, hygienists, some from safety net clinics, some in private practice, some from rural, some from urban. It's kind of a really good cross-section of the state. They get together, actually the other group gets together once a month. This group gets together just once a quarter. And they do kind of the same thing. They look at some of our provider resources, make sure we're putting together things that are useful. They are advising us on different advocacy strategies, so we're learning a lot from them. So just want you to know, we've got some genuine people at the table who are consumers and who are providers who are helping us understand how can we be the best possible advocates for oral health in the state. And I think that's the last of it, and there's my contact information. And thanks. I appreciate the chance to share all of this with you today.
Thank you, Ms. Bruner. That was a great presentation. Any questions?
Sorry.
Yes. Representative Steen.
Yes. Thank you, Mr. Chair, and thank you, Tanya, for your presentation. Hey, I just had a quick question, sorry. On your Medicaid dental provider network, this map here, do any of where you have providers, do they travel over into the other counties, some travel around some to provide for those Medicaid patients?
That's a really great question, and I think I may have to research that one for you. That data is from the Medicaid program itself, so we asked them which counties have Medicaid dental providers and how many in each county. So I can get in touch with them and find out that answer, because I don't know and I don't want to misspeak.
Thank you.
Yeah, that's a great question.
Representative Berquist.
And my question was probably real similar. Have y'all done Mission of Mercy?
We have, and my colleague is going to be talking about that here in a few minutes. Yeah, we actually do at Oral Health Kansas. We volunteer at that as well. Yeah.
Thank you.
Any other questions? Okay, thank you so much. That was
Thanks
a great
again.
presentation.
Thank you.
Appreciate it. We now have Kansas Dental Association, Kevin Robertson. Thank you,
Mr.
sir.
Chairman. I think I'm just going to throw in the towel right now because I've never in my life had as much energy as Dr. McKinney, and I don't have a PowerPoint, so we're just going to kind of get into it here. I am the executive director of the Kansas Dental Association. I'm going to talk a little bit about what the Kansas Dental Association does, but then also just really about kind of general dentistry things that you might be of interest. So I do have my comments. I'm going to run through these quickly so you can get out of here. I know you guys all had a really very long day, so we'll get rolling. But just so you know, the Kansas Dental Association does represent dentists, and so when we talk about dentists, we just don't talk about that general dentist or family dentist that you think of, but it's all the specialties as well. So orthodontists, oral surgeons, periodontists, endodontists, and the like, pediatric dentists. Those all are dentists and make up the Kansas Dental Association. The Kansas Dental Association itself does association-type things, right? So we do offer continuing education for our members. We have different networking opportunities. We have a program called Peer Review, where we work with dentists and their patients that might have complaints. We try to mediate those. Now, we're not the Kansas Dental Board, but there's sometimes where we can help kind of get them over the edge so they can work out their problems and differences. We also have a contract contract with the Kansas Dental Board to provide the substance abuse or well-being program for dentists that might have some substance abuse issues, to help them work through those issues. If a dentist has a problem, they'll get referred to that program. They will go through that program before they can get their license back if it's been suspended or whatever. So those are some of the things that we do. We also do a lot of work with the Kansas Dental or with UMKC School of Dentistry. So to back up just for a second, Kansas does not have a dental school, right? So make sure everyone's well aware of that. Kansas does not have a dental school. UMKC School of Dentistry in Kansas City is our dental school. There is an agreement between the Board of Regents and the Missouri curators that provide 30 dental seats for Kansans at UMKC School of Dentistry. So those students go to UMKC, they pay in-state Missouri tuition, and we try to stay in contact with them, stay in contact with them to make sure they know what the opportunities are when they come back and when they graduate, so that we can get them to come back. Now, we have 30 seats at UMKC. There's 66 dental schools across the country. As you would imagine, most of the dentists in Kansas are UMKC grads. However, regionally, there are several dental schools. So UMKC has 108 total students. Again, 30 of those are ours. We know that there's Kansas residents that can't get in as Kansans because we're a little bit limited. So they'll become Missouri residents, and they'll be get in as Missouri residents. So we usually have another 6 or 8 per class that are Missouri, on the Missouri side, but they're really Kansas residents. So we have those at UMKC. There's a brand new school that just opened up at KCU, or in Joplin, KCU Joplin. That's a private school. That's a class size of 80, so they're just in their second year. So those students haven't graduated. They haven't come out yet. That school their mission is to serve Southeast Kansas, Southwest Missouri, Northeast Oklahoma, and Northwest Arkansas. That was their stated objective. We have AT still Kirksville, Missouri. That's the Missouri School of Dentistry and Oral Health in Kirksville. That is another private school. So those are the ones kind of close by. Of course, we do a lot of work with University of Nebraska Medical Center up in Lincoln. They have a class size of 55, and then Creighton is 85 students up in Omaha, and then Oklahoma and Oklahoma City. So there's a lot of dental schools kind of in the area, and we have literally representation of all 66 dental schools as far as the dentists that practice in the state of Kansas. So a lot of folks going on, and that's kind of what that climate looks like. Dental school themselves, or itself, is a 4-year program to be a dentist. And then if you're going to specialty training, that's another 1 to 2 years, depending on what you're doing, or even 4 if you're going to be an oral surgeon. So in Kansas, Wichita State has an AEGD program. That's like a residency program. They have about 6 students down there at Wichita State. That's for general dentists that want a little extra training. It's a 1-year program, and so they can do that and then get out into the training. It's not a requirement, but some folks want, some of those students want a little extra training before they start doing other things. As far as dental access, the Kansas Dental Association since 2012 has partnered with Delta Dental of Kansas on what we call the Kansas Initiative of New Dentists Program, or Scholarship and Loan Forgiveness Program. That's a program that works to get dentists into rural areas. It incentivizes those students. So we can, the biggest scholarships we've ever given is $100,000. And then depending on how much money those students get, there is a service agreement where they have to work in a rural area. They have to be a Medicaid provider during that service agreement time. So we've had about 20 students right now. They've graduated. They're out there working that have been part of that program. And dental school itself, as you might imagine, is not inexpensive. Depending on really public versus private, it could be anywhere from $50,000. Actually, KCU Joplin, the new school I talked about, it's $105,000 a year with tuition and fees. One of the most expensive schools, frankly, I've seen, certainly in this area. So it's a very expensive school. So, students are coming out with, $400,000+ in debt, and that drives then what those practice decisions are as they start their practice life. So that's the KIND program. Talked about that a little bit. Sorry, going through my list here. The Kansas Mission of Mercy, Dr. excuse me, Representative Berquist. Appreciate you bringing that up. So,
Thanks for the upgrade.
yeah, yeah. Well, never mind. So we are happy. Our foundation, the Kansas Dental Charitable Foundation, started working and created the Kansas Mission of Mercy 24 years ago. We just finished our 24th project. It is a large dental charity project. On page 3, I don't have slides, but I do have a picture to kind of give people an idea. That was last year when we were in Salina. We'll set up about an 80-chair clinic where we'll have about 80 operatories with dentists performing different procedures. We'll be, oral surgery, extracting teeth, as well as do a lot of fillings. We'll have hygiene set up. So we've done 24 of those, and we're the only state. There are several states that do a Mission of Mercy. We're the only state that's been able to do 24 continuous Missions of Mercy, even through COVID. It just worked, the dates worked out for us, and we made some changes. So we're very proud of that fact as we continue to do that. In all, we've provided about $24 million in care to 33,000 patients across the state of Kansas, been 11 different locations. Those locations depend a lot on facilities that are available, because to set up that clinic, it does take, a sizable amount of time, and they have to have the space available. I mean, going to a high school gym just doesn't work for that size of a project. So we're excited about that. I tell you, it's all privately funded. It takes about $150,000 for us to put on a project. We've never asked for public money. Never received public money, and my caveat for that is always some of the facilities we've been into over the years are city or county-owned type facilities, and they give us a discount or a break, or maybe the local police department or somebody like that will get some security that discounted or free of charge. But as far as dollars, we've never gotten tax dollars for that project. Big shout out to Oral Health Kansas, who has helped us out with our exit surveys. I have some of the results of our exit surveys over the years, kind of give you an idea of the types of comments that are made. But generally, we find that most of those dentists, or most of those patients, traveled less than 2 hours to the clinic. Almost 80% did not have dental insurance, anyway, as they report. And most of them said that they could not find a dentist to treat them locally. So that's why they're coming to our clinic, and we're happy to do that. Blue Cross and Blue Shield Foundation and Delta Dental, again, have been huge supporters of the Kansas Mission of Mercy. I am pleased to say I get to skip some of this on Medicaid and some of those things, because Tanya talked about those with her Oral Health Kansas report, so we don't have to discuss all those things. The sedation, dentistry, interim, we support those types of things that came out of that, and we've been testifying for that within the Social Services Budget Committee here over the last week. Another program that we do is a donated dental services program. That's a program where frail elderly and people with disability can get care. There's a network of about 320 dentists, and over the lifetime of that particular program, we've provided about $16 million in care. So that program, the dentists provide the care free of charge. The state does support a project coordinator that then works with those patients and the dentist to kind of link them up to get that care done. So I'm going to wrap up with two things. Workforce, like all healthcare professions since COVID, workforce has been a real issue in dental offices. A lot of auxiliary staff retired early, have chosen not to get into the field, or have moved on. So that continues to be a problem, particularly in rural Kansas. And this last year, I think Chairman Carpenter mentioned it the other day, or asked another conferee, we did pass, you all passed the dentist, dental hygienist licensure compact. That required a minimum of 7 states to activate that. There are 10 states now that have activated that. That compact commission has met twice now as they start to go through their rules and regs on how that thing's going to all work and come together within those 10 and hopefully an increasing number of states over the next several years. So we're hopeful that'll get rolling quickly and that will be a way to help dentists and dental hygienists kind of move more freely within the states that are in that compact. So I am going to step aside and let you ask me some questions.
Thank you. Committee, any questions? Yes, Representative Oropeza.
Thank you, Chair. Vice Chair Bryce, thank you. I have a quick question in regards to the compact for the dentist and dental hygienist. We're at the table, correct, being a state, since we were one of the ones?
Oh, absolutely. As a matter of fact, Lane Hemsley, the executive director of the Kansas Dental Board, is on that commission. And yeah, we are absolutely at the table.
Okay, thank you.
Ms. Robertson, I've worked with some physicians trying to find, or I've worked with rural communities trying to recruit physicians to the rural communities. And I think you mentioned the loan forgiveness program through Delta Dental and so forth.
Right.
Do the graduating dentists ever work directly with the communities to negotiate them to start a practice?
Yeah, we do. So we try to help them to, if they don't know where they're going to go, but they want to go back to rural Kansas, there are some communities that we're well aware of. Their economic, those local economic development committees have some dollars set aside as well. So we try to maximize, the dollars as best we can. The program, that we have some issues with, not issues, but there are different scholarships, competing scholarships that they can't have two separate service agreements like the National Health Service Corps. So sometimes that can be an issue for us. We don't have those restrictions, but the National Health Service Corps does. So we try to work kind of to, again, help those students or new graduates maximize their dollars. But proud to say that of the students that we've placed in rural areas, there's really only one. One actually went to Chillicothe, Missouri, had to pay us back on that scholarship. And then there's one right now that's in Manhattan, but everyone else is still practicing in or around where they went. So,
thank you. Very good job. One more question, Representative Blacks.
Thank you, Mr. Vice Chair. Thank Kevin for being here. We hear a lot about the timeline it takes for a dentist or a physician or whatever from another state coming into our state. What kind of a timeline for a licensed dentist, to say in Nebraska, that wanted to come to Kansas to get practice? What kind of a timeline's there?
I don't know. Lane Hemsley with the dental board would be able to give you a better answer. However, I will tell you that Kansas and the Kansas Dental Board has a very streamlined procedure on that. So if that dentist coming from another state has a clean record, they do have to take the jurisprudence test in Kansas, but assuming they have a clean record and they do the background check, it really should not take very long. I just don't know the exact timeline, Representative Black, so I can check on that with Lane and get back with you if you don't mind.
Thank you, Mr. Chair.
One quick question, Representative Steens.
Thank you, Vice Chair, and thank you, Kevin, also for that presentation. I had a really, so my neighbor goes to, her son is in the program in Joplin.
Oh, very good.
Has there ever been a discussion, and maybe you said this, and I apologize if I missed it, about starting a dental program at a college?
Well, yeah, I mean, it comes up from it comes up from time to time. I can tell you Wichita State right now is talking about it pretty significantly. They have right now they'll be asking you all, because I don't think it's in the governor's budget, but they're looking for some money to do a study on a dental school. And, they were talking about a $93 million facility to be part of their downtown I don't know what it's all called, the bio center they're building downtown in downtown Wichita. So they're certainly talking about it. So I think in the next couple of years that will be a topic of discussion.
Great, thank you.
Thank you. That's a great presentation. I appreciate it, Mr. Robertson. And committee, I believe we are meeting next on Monday. We're off tomorrow, right, Dave? Okay. Meeting is adjourned. Thank you.